right. Now we have moved from decompressing calcaneus, medial lateral shear of calcaneus. Now we're going to layer on talus mobilization. So with the talus, the first thing we want to do, similar to the calcaneus, is we want it to distract away from tib fib, okay? In that talocrural joint. We want that ability to distract before we do shear, before we get it to glide posteriorly, before we get it to glide relatively anteriorly, okay? So in order to distract, you could just go into what a lot of people do, which is that manipulation, which I do a lot of the time. Great thing to do. A lot of people know how to do it. There are kind of details that would be worth going over at some point to wind it up better. But for the purposes of this, we're going to use a functional mobilization or muscle energy technique to get that distraction moment very focal. Okay, so I have one mobilization belt that's kind of going around, ideally level, like lower thoracic area, not quite, ideally not, I mean, I probably am TL junction, but ideally it'll be like a little bit higher so that you're not just kind of shearing your lumbar spine forward. If you have some hypermobility there, you may need to go even higher than what I'm doing. But I kind of get this around to where my hands, if I have my hands out like this, I have a little space for the foot, right? I don't want it to be so close that there's no space for the foot to go. And then I stack my hands on top of each other. And my ulnar side or my pinky side is going to be what does the mobilization. So I'll show you on this as well. So I stack here with pinkies right on that talus. I'm going to take her foot into dorsiflexion, and then I'm going to weight shift back to relatively decompress the talus away from tib fib. Okay, so getting back into position. I have a second belt where she is going to assist in dorsiflexion, so go ahead and pull that up. There we go. So she has that there. I hook down onto, and soften that just a little bit, Kelsey. There you go. So now we're in position. I am going to localize her by going into that ulnar deviation, but also just kind of localizing through my hands into the direction that I'm most interested in mobilizing her. So now she can take up the rest of the slack, and now we are connected, okay? So I like to press out with my elbows a little bit. That just further increases that hard infill through my hand as I weight shift back, okay? So she can hip hike here. So go ahead and hip hike, good. That takes the rest of her leg away from the talus and let it go. Good, sometimes you have to cue your patients to get the tendons on the front, the anterior tibialis and extensor digitorum tendons to let go. Good, so she relaxed that. Hike up again, so that's the hip hike. And let it go. And again, I'm trying to like scoop down into ulnar deviation. And as I scoop into ulnar deviation, I'm pressing my thumbs with her foot into more dorsiflexion. All right, and then now do the gas pedal. Good, resist with your hands, pull up with the belt. There we go, that helps me not have to do it all with my thumbs. And let it go, pull it further up into dorsiflexion as I weight shift back to decompress. Good, again, and let it go, okay? So this is a way with belts to get a distraction of the talus away from tib fib.